live from the Bommarito Digital Studio.
Welcome to Great Day Extra Live. Our guest today is Dr. David Yablonsky with Victory Men's Health, and he's returned today to talk about, among other things, men's health issues, including erectile dysfunction, which is, I guess, a big part of the practice. But,
correct.
Among other things, right?
That's right.
All right, so let's welcome back, by the way.
Good to be here.
Glad to have you
it's
here.
A pleasure. Thank you.
Talk to me about, how did you get into this part? Because you have a regular medical practice, right?
Right, my day job.
And made the decision to start the men's health clinic as well.
Yeah, and I just full disclosure, I didn't start it, so I can't get that credit. I wish I could, but I didn't. But I work for it, and I'm their medical director. Okay. And I know the people that started it and own it. So, yeah, I'm an internist, trained at a big University of Rochester in upstate New York about 20 years ago, and board certified in internal medicine. And I still take care of very complex medical cases, chronic ailments, chronic diseases, diagnose people with unfortunate situations. But this is a real fun part of my week. It's a little more lighthearted because what we do at Victory is we're more focused on optimization. Guys are coming in not feeling well, not necessarily because they're sick. It's not like they're coming in necessarily with diabetes or heart disease or, God forbid, cancer, things like that. Now, that being said, we do find that. I always have to be alert to that being the possibility.
Well, that's the beauty of having a medical doctor in charge of this, is we're talking to a medical doctor, not somebody who you would expect to not do a full and complete diagnosis.
Exactly. So we still have to be on the lookout for those things that might make them feel like they're low energy, low libido, erectile dysfunction. A lot of cardiovascular disease, for example, can present that way. Diabetes can. We've picked up brain tumors on people that affect their endocrine system and their hormones. So,
but many times it's not out of the ordinary things. It's things that we can address that are specific to men.
Exactly. And so this is the part of the week where I get to talk to guys about wherever you're starting. You know, I meet people where they're at. So some guys are coming in and they're 40 years old, and a year ago they felt like $1 million and they've just declined over the last year. Some guys are coming in at 80 and they just want to feel like they're 70 again. And so we get to talk about feeling better, and that's another type of day for me compared to my other practice. I like it all, but this is its own little niche, and I've done a lot of training over the years in this area. We have to really know a lot about how men's hormones work, and how we can use that to men's advantage to optimize their health, among other things.
Sure. Do you find that, of course, women have their OBGYNs that they can see that they're specific to their gender issues, gender-related issues. Do you find that a lot of men, when they go to the normal practice, that they're maybe a little hesitant to talk about these kinds of issues? Oh,
yeah, two things. One is, just as you said, they're hesitant. It's a topic that oftentimes, if it's not asked, they're not going to tell. The other thing is, in healthcare today, especially in an insurance-based clinic, a traditional clinic, there's no time. We're putting fires out. So we've got people coming in with, like I had mentioned earlier, a multitude of problems that might be on many medications. And it's not that it's not important, but unfortunately,
you're on the clock.
It gets pushed down. You know, I got to deal with your bad heart and your bad kidneys first, and no time for just feeling better. And so that's the unfortunate reality of a traditional medical practice.
And I think a lot of men don't realize, perhaps, correct me if I'm wrong, that there is something that we can do about some of these issues. And and it's not just, you don't have to feel old, and you don't have to feel tired all the time necessarily.
Absolutely. And, you know, so women, there's the term menopause. Everybody's heard of menopause. Everybody knows what it is. And nobody denies.
Is there a menopause?
There is. It's called andropause. And this is not my term. This is textbook stuff now. This is recognized. Just like women, men start to lose some of their hormones, particularly testosterone. So in a woman, when she starts to go through menopause, that's the estrogen levels going down to the point where she produces very little. In men, it is testosterone. Other hormones as well, but testosterone is the main one. And so we call that andropause. And for many years, men just, well, this is what it feels like to get old. Now we understand, yeah, you're getting older, but you don't need to feel like you're getting older quite yet.
Right.
Inevitably, hopefully we get older.
We can buy some time.
Exactly, buy some time and quality of life, feel better.
Talk to us about some of the complaints. I'm going to call them complaints, but
Sure.
I guess you would call them symptoms that they present when they come in.
Yeah, and yep. So this is what we're seeing all day long. Most of the guys are coming in complaining of fatigue. They're hardworking guys. Many of them still have kids at home, and so they have family responsibilities. They're knee deep in their careers. They're doing it all. They're getting by, but they feel horrible. You'll hear them tell me, "Yeah, I do what I've got to do. I get home 5, 6 o'clock. There is nothing left. I want to go work out. I have no energy. I want to go to my kids' functions. I drag myself there, but there's just nothing left of me." And then I start it up the next day and do it again. That's a really common complaint. Throw in there, yeah, by the way, my sex drive's way down. My wife's kind of complaining. She thinks maybe I'm not attracted to her anymore, or my girlfriend. And with that, yeah, I guess I have a little erectile dysfunction. What do we mean by that? We can talk about erectile dysfunction. The term gets thrown around. But what's happening is usually the guys complain that there's some difficulty achieving a maximum erection. And more commonly than that, the real thing that seems to bug guys, and maybe their partners as well, is maintaining the erection.
We talked about the issues that men have because you're working hard, because I can relate to that, in that we feel tired, but we think that a lot of these other symptoms are just related to that. Well, yeah, I don't get enough sleep. Well, there's a reason why you're not getting enough sleep. And a lot of these, we talked about this earlier on the show, a lot of these symptoms kind of overlap with each other, right?
That's exactly right. And so guys don't know where to turn. If you're coming through a traditional medical practice, and again, I have the experience of seeing this, sure, sometimes they'll work it up, fatigue, but oftentimes we don't find anything wrong per se, meaning we can't find a disease.
Right.
And so it's not looked for in a traditional medical practice. Whereas we're going to look at not just testosterone, which is important, but a multitude of hormones. We're going to look at metabolites of growth hormone. We're going to look at hormones that's called DHEA. We're going to look at iron levels, all the traditional stuff too, blood sugars, blood counts, kidney, liver, electrolytes, all that stuff, PSA, but a much more broad brush is used in this case.
We talk about sleep a lot on this program, and how important that is and tied to our overall health. And looking back at some of those symptoms that can cause us not be able to sleep is important too, and is important for men and for women.
Yeah, sleep deprivation, I'm convinced, is a real problem in this country. I didn't realize till we started asking people how many people it's such a, we don't, you think, well, we eat every day, we go to the bathroom, we sleep. These are just normal things that every human being does. Why should there be a problem? And yet so many people, and the men we see, are having issues with sleep. So sometimes it is related to some of these hormone discrepancies that they have, and we can help them. There's certain things and it's not that we treat sleep. We're not a sleep disorder clinic, but you're right, things blend together. It's not these discrete boxes.
Right.
They all connect, and so we always ask guys about how they're sleeping. And I'm a big advocate of lifestyle. So I'll talk to guys and let them know, hey, look, I'm going to do some things for you. It's going to help you a lot. You've got to do some things for yourself. If you need to lose weight, and we weigh guys, we get not just a body mass index, but when they come in, we have a very fancy scale, I guess you could say. It's not something you would typically see in a traditional doctor's office. We'll look at your muscle mass. We'll look at body fat percent. We'll track it on our guys, and we'll make suggestions that you need to lose some weight. That's part of it. You're not eating right. Your nutrition's not good. Your stress
so you do
levels.
Address diet.
Yes, and we don't necessarily have a diet
not
program.
Diets, but a person's diet. They're
absolutely. We have to know that if you're coming in saying, I feel lousy, I feel tired, I don't have any vigor at the end of the day, and I look at you and say, oh, you're 50 pounds of too much fat, and clearly I'm talking to you now, I'm finding out you go to fast food every day. Guys neglect themselves, and so they're taking care of their jobs, their family, everything else but this machine. And so it has to be brought up. It's a place where we're going to bring it up. We're going to plant seeds now about lifestyle, and I'm going to augment that. I'm going to start putting the frosting on the cake by getting some of the things that I can fix optimized, like hormones.
We're talking with Dr. David Yablonsky with Victory Men's Health, and about a clinic that's set up specifically for men. And one of the things that we talked about, and by the way, if you have any questions, by all means, let us know at the bottom there, make your comment, and I'm monitoring those, and I'll be able to take a look at them and then pass those along to the doctor. But we've talked about the fact that historically women have always had, and rightfully so, have had an office that they can go to where they can be comfortable talking about their gender-specific issues.
Right.
It must really be relief to a lot of men to be able to walk in and know that all the focus is on men in that clinic and on their issues.
Right. We have our unique problems and our unique needs being of the male species, and not to mention the environment is set up to make it a place where you actually like going to.
Right.
It's
that's important.
The offices are unusually nice. They're not intimidating. They're not pretentious. But it's a place that you're going to feel comfortable. I like going there. Sometimes I don't really want to leave because it's very nice.
And don't forget the name of this is Victory Men's Health. It is not, it's not like men are going in there and everyone is dealing with erectile dysfunction issues. There are all kinds of issues.
Right.
So I think there's a comfort level that's a big part of this for a lot of men, I would imagine.
Right. And it's not replacing your primary care physician. This is something that should be done in addition to. We've had some guys come in and even some doctors out there that are like, oh, don't go there, I'll take care of that. But there's nothing to be threatened by. We'll gladly work with patients' primary care physicians as well. So we're not really duplicating or doing something instead of them. We're doing the part that never really gets addressed. And I should know, I have one of those clinics. I have a traditional medical clinic too. So like we were saying earlier, just don't have time to address optimization. So this is the place to go.
Talk to us about that. You use that word, and I think that's very good. That's very descriptive about optimization, meaning that, like you said, at a certain age, yes, we may start to feel some things, but there's not a line in the sand that says, "Oh, you're old. You're just going to feel that way now."
Yeah. That's the old school. I had some training done 20 years ago when I was first introduced to this idea that, well, we're going to get older. There's no such thing as preventing that. Well, you can die, then you won't get older, right? But you're either going to die or get older. And so the concept is, if I'm getting older, and we know as science people that many of our hormones and some of our nutritional states diminish, they just keep decreasing. Right. Do we have to accept that, or can we safely replenish that? Safely. That's such a key. And the answer, of course, is yes, we can in most guys, in many guys. Every guy that comes in, we look at as a unique person. So there's not a cookie cutter way of addressing it with each guy. Every guy has different needs.
And you're not touting this as the fountain of youth. You're never going to feel perfect again, but why not feel the best that we can feel safely, first and foremost, be at our best? And that takes us back to that term, optimization.
That's exactly right. And that being said, depending on where some of the guys are coming from and how hard they work on their own lifestyle, we have plenty of guys that are, when you see them back and you ask them, how are you? Their answer is, I'm fantastic. I'm amazing. I'm better than I've been in 20 years. I mean, this is not an unusual story to hear. And that's fun, from my end of it. That's very rewarding to hear that. And we hear that all day long. So you're right. There's not a panacea per se, but what we do is very simple. This is all science-based, and a lot of common sense goes into it. It's not as difficult as people may think it is.
And again, this is a medical doctor leading the clinic. We're not, like you said to me earlier, you're not hawking products.
Right.
This is taking a look at the overall health of men.
That's right.
And trying to optimize that. You talked earlier about working out and how guys that say, oh, I get home from work, I'm so tired, I don't feel like working out anymore. We can get you feeling better. Then you feel like working out. It's like a bonus, boy. It really starts to.
That's right. So the power is all these things together. Excuse me. Everything working together. What I'm going to do as a physician for you with some of the supplements and hormone modulation, what you're going to do in your diet, lifestyle, sleeping, working out. These are critical. You put them all together. Very powerful. You can regain your youth, regain your vigor. Your job's going to go better, your career goes better, you're going to be a better spouse, a better parent. You reset the clock a bit.
You know, you talked a little bit earlier about shortcomings, I'll call them, that some of us might have, some of us men might have. Talk to the wives and significant others a little bit about how they may want to address this with their mate and say, you may want to talk to this doctor because I saw him on Great Day. And
yeah, we love when the wives and girlfriends come in, or significant others of any sort, and
come in with the patient.
Sure. You can send your guys in, but you can come in too. And it's a very powerful support system for the guy. If you're sitting there and say, in your case, it's your wife or me and my wife, and just by the fact that she's there, that tells me you've got a great partner here. They're not here to tell on you. Hopefully they are a little bit, but only because they love you and they've noticed that you're not as good as you used to be. And so, but even guys that come in without their spouses or girlfriends or significant others, I think it's great when it's talked about at home. Send the guys in there. You know, I'll certainly take care of the rest when they come in here. But oftentimes when you talk to men, if they're being honest, yes, their wives, girlfriends, whatever, they've noticed a change. And that's, I think for most men, that's a really powerful motivator. I know
it's a powerful moment in a man's life.
Oh, it is. I mean, when I was young in my training, I started to neglect myself because I was so busy. And I'll remember asking my wife, like, you don't look at me the way you used to. This is about 20 years ago. And it was her honesty. I've never missed a workout in 20 years because of my wife saying, yeah, you look fat naked, David.
That's not what you want to hear, right?
Yeah, I had to hear the truth, though.
Well, that's what it takes sometimes. Yeah. Well, I do think it's important for that significant other to have a role in this as well, and to say, hey, I saw something on TV, or I saw something online, or I heard about this from somebody else. Let's just look into it. That's all. You just get them in the door, and then we can talk about what some of these issues are and how they interconnect with other issues in our life, whether it's diet or sleep or hormones or anything else.
That's right.
And put that puzzle together under a medical doctor's care, and with safety first, like you said earlier.
Absolutely. And you don't have to be rich to do this. This is not terribly expensive. It's $99 to come in and you get a consultation and a review of this extensive lab panel, and I think it's one of the best deals out there. I mean, people spend money on much sillier things than something like that. So you don't have to be rich to do that. And if you do end up doing some of the programs that we may suggest to you, same thing is, you don't have to be rich. This is not just for the super affluent people. Most of our people are not rich. Most of our people are middle class that we see.
All right. Well, there are two locations. There's one on the east side in O'Fallon, Illinois at 618-632-9000. Where is that located exactly? The address?
This is the O'Fallon. So I put my Waze on and it just takes me there. You've
it's on the screen. Me. There it is. I'm sorry. Here it is. 1405 North Greenmount.
Yes,
okay.
That's right.
Sweet. You sure?
I'm positive
Don't
now.
Go to the wrong
all
place.
ringing a bell.
1405 North Greenmount Road, Suite 240. You might want to have that memory looked at while you're. I get like that too. Believe me, it's hard when keeping track of all the numbers. All right, and the second one is on the Missouri side. That's in Town and Country at 1036 Town and Country Crossing Drive. And you can reach that one at 314-833-9000, or the Illinois location at 618-632-9000. So 632-9000 on the Illinois side, 833-9000 on the Missouri side. Or if you want to get more information, this might be something that you could point people to as well if you're a significant other, victorymenshealth.com. Write that down, victorymenshealth.com. Thank you, sir.
Great to be here. Thank you so much. Appreciate it. All right.